All right, we are recording. Welcome everyone to the first event of the series of how to get into med. This one specifically is about med interviews and MMIs. So that's the topic of today. But before we jump in, we will just do an acknowledgement of country. So I would like to acknowledge the traditional and rightful owners of the land in which everyone is on today. I myself am on Yorta Yorta land, so I would like to pay special respect to the owners of my land. I'd like to pay my respect to the elders past, present and emerging, as well as pay my respect to any First Nations people who are with us in Zoom land today. So first things first, if you haven't heard of us, we'll give Halad a bit of an intro, but we are all part of the Halad Health team. So we do a lot of things. We're in the GAMSAT world. We're also in the MMI world, but we're a lot more than that as well. We're basically a not-for-profit organization that was started a couple years ago by a bunch of biomed friends who just wanted to make a difference in the world, make some sort of social impact with the skills that they had. So we provide tuition for GAMSAT, for MMIs, also for MD1s at Uni Melb, as well as some biomed revision sessions, all raising funds for the missions that we do in the Philippines, in person and virtual now, providing free health education to students living over in the rural areas of the Philippines. So if you'd like to stay up to date with what we do, definitely follow us on Facebook and Instagram, as well as our website to find out more and see how you can get involved further as well. But we'll just do a little introduction of ourselves. So as you heard us chatting before, my name is Gabby. I'm an MD2 at the University of Melbourne, placed in Shepparton this year. So I'm a part of the extended rural cohort. So I'll be spending the next 3 years in rural sites and am loving it. So if that's something that you're interested in, I'm always happy to have a chat about rural health. I'm also on the GAMSAT team as a Section 1 and 2 tutor, and I'm the MD1 academics coordinator as well. And Karim, did you want to introduce yourself?
Yeah, thanks for that, Gabby. My name's Karim. I am also an MD2 at the University of Melbourne. However, I am at the Austin, which is sort of like northeastern Melbourne. And I will be there for the next 3 years, so not moving around very much. And yeah, really loving the course so far. For those of you interested in being part of Melbourne Uni, it's a fantastic course, definitely a bit of a plug there for them. I'm also the Section 3 lead and tutor at Halad to Health, and I also help run the MD1 revision sessions that we do for Melbourne Uni. And Gabby and I both run the podcast. So we are co-hosts for the podcast Making an Incredible MD by Halad to Health, where we produce a lot of content that will help you guys out. But we'll talk more about that later down in the presentation. But yeah, that's me.
Yeah. So before we jump in, we just wanted to touch on well-being first and foremost. Most people in this Zoom, I would say, are probably in lockdown at the moment, and probably not their first lockdown either. It's been a really tough couple of months, but actually a couple of years now, coming in and out of lockdowns. So it's really important to stop, especially if you're studying for the GAMSAT or studying for things like MMIs, waiting for med offers. It just adds an extra layer of pressure and anxiety to what is already a really tough time. So we just wanted to put this slide in here to give you some resources and give you a reminder to put your well-being first. Although preparing for med interviews is really important and may seem like the most important thing in the world right now, the most important thing is your well-being and your mental health. So please make sure that you do look after yourselves and look after the ones around you as well. We're here to support each other. So just a little reminder before we jump in. But Karim, did you want to start with the agenda?
Yeah, sure. So in terms of what we're actually running through today, today's focus is completely on medical interviews. We've kind of labeled it as MMIs, but we are talking just generally about medical interviews. We'll run you through what they are, the types of stations, how to go through them, how to structure your responses. We'll touch on some of the stats, some of the statistics, some of the actual MMIs and how they're structured at different universities. We'll talk about when they happen. We'll talk about previous data for receiving an interview offer. But yeah, most importantly, today's sort of focus is on how to prepare. And we'll also run you guys through a bit of a station that we came up with to test your skills. So you'll get a free added bit of practice in today. The content we are sharing is based on information from previous years. So this is sort of our disclaimer. Please do not take our advice as fact and make sure you do your own research, particularly regarding the process and dates of universities that you are applying for. Yeah, really, really important that you do your own research and that you're confident with the process and everything that you are required to do.
Yeah, things can change at a drop of a hat in any regular year, but especially with COVID, interview dates might change. Emails. Yeah, and the university's website and stuff as well. So this is the information that we have gotten as per this week, but things definitely do change, so keep an eye out on it. But let's just start with, what is an MMI interview? Krim, what is it?
Okay, so essentially it is one of the most common forms of interviews conducted by medical schools across the world, not just in Australia. But it stands for multiple mini interviews or stations. So essentially each station is its own interview. So you're looking at anywhere between 5 to 8 minutes where you'll be asked questions. Lots of the time it will be based on a specific scenario. Different universities have different allocated amount of times. So yeah, usually between 5 and 8 minutes. And there can be quite a few stations, so there could be up to 8 stations sometimes. But yeah, there's a lot of variations between what different universities do. So if you do get an MMI interview offer, make sure that you know exactly how your university runs their MMIs. The most common types of stations that MMIs tend to have, we've sort of come up with 4 different ones, but honestly the amount of scope of different things that they can throw at you is huge. But there are more, sort of about 4 things that tend to come up often. So you've got ethics, personal attributes, task or explain station, and an acting station. They're sort of the most common ones. But yeah, we'll go through those and we'll explain sort of how to break them down and how to structure them essentially.
Yeah. So let's break down those 4 main types of stations that we've come up with. The first one's being the ethics stations. So this is the one that most students talk about and most students freak out about, I think. And it's definitely something that I was worried about, because within ethics stations, you can have so many different types of scenarios and so many different topics that can be explored as well. So it's not just pure ethics, but basically the whole point of these stations is to test your understandings of key ethical issues and to see how you can approach ethical problems, because doctors are required to have an excellent ethical framework. Ethics is a huge part of being a medical professional. Even just being a medical student, there's so many ethical scenarios that you get yourself into that you need to be able to navigate, and you need to be confident in your approach to navigating it as well. So this is just a really easy way for the universities to test your ethical framework and your ethical decision making. And some common topics which are tested within ethics stations, of course, the 4 main pillars of medical ethics. If you don't know them, they're very important to get across. Autonomy, justice, beneficence, and non-maleficence. So Karim, did you want to give us a quick definition of those 4 pillars?
Yeah. So if you haven't come across those before, autonomy is the ability of the patient to choose what medical treatment they receive. Justice is basically about doctors treating everyone equally. Beneficence is wanting to give patients options that provide benefit to them. And non-maleficence is trying to avoid harm to patients. It doesn't mean no harm. It just means trying to minimize harm, essentially.
And you can read heaps about these. There's so much about it online, but I think the most important thing is just being able to discuss it in your own words and what it means to you, rather than reading lots. So if, reading a bit about it helps you get more comfortable with those concepts, then go ahead, but definitely don't spend heaps of time reading up about it if it means that you can't apply it.
Yeah.
And then
the
there's
advice we give is that you should sort of be conversational in each one of these topics. You should be able to hold a conversation about each one of them. You don't need to be an expert by any means.
Yeah, for sure. And then there's other concepts as well, such as the mature minor, which is an ethical framework around how adolescents, 14, 15, 16-year-olds can make their own medical decisions, which is really complex and convoluted. So again, not something that you have to be 100% across, but definitely something that you are willing and confident enough to have a conversation about. Empathy, a huge one. It's a part of every station, I would argue, because it's, one of the most important things to have as a doctor. And hopefully you all know what that one is. Informed consent and capacity for medical decision-making is, again, a really important one that sort of comes under autonomy, but it is in its own right something else. So being able to gain informed consent from someone, being able to know sort of what that means, how to get it, and how to, have conversations about it, again, really important. Limited resource distribution and utilitarianism. Karim put down this example of no jab, no play. Did you want to elaborate on that one, Karim?
Yep. So in terms of limited resource distribution and utilitarianism, they are sort of slightly separate, but limited resources is you've only got a certain amount of things to give out to this many patients, but who gets what essentially. And the classic example is like organ transplant. There's only so many organs to go around. Utilitarianism is the idea of benefit for the greatest number of people. So the no jab, no play example is that to allow children to go into like kindergarten, they are required to have certain vaccines, so they are not putting other children at risk. And so it's the parents' choice of whether or not to vaccinate their children. But if they don't get vaccinated, well, then they can't be putting other children at risk, essentially. So that's the idea of utilitarianism. Which is, one person might go through one thing, but it provides greater benefit for everyone, sort of.
Yeah, I think that's a great definition. And we have our first question. So would it be good to actually specify that you're discussing the principles of bioethics, as in actually stating based on the principle of autonomy, or is that something unnatural to say? Do you have a strong opinion about that, Karim?
I don't have a strong opinion, but I do think that it's really great when you just say these words, conversationally, just because it shows the interviewer that you know exactly what you're talking about. So they can kind of just tick you off. I don't know. I sort of imagine that interviewers, they have so many interviews that they go through. So, and you've only got a minute to answer things, right? So if you say autonomy, they kind of can just like tick a mental box in their head. Oh, this student understands autonomy. I don't think it's an unnatural thing to say, but you can always just say the patient's right to choose, and their interviewer will understand exactly what you're talking about. So it's whatever you're comfortable with, honestly.
Yeah, exactly. Whatever is more natural for you in that conversation, and in that scenario as well. And I think it's always good to, back that up. If you're going to say something like based on the principle of autonomy, state what that means to you, what that principle means to you. Don't just, state the definition word for word, because that might come across as unnatural or too rehearsed. But if you have an idea of what that means to you and what that actually looks like, I think that's much, much more powerful than just reciting something from a website. But great question. And feel free at any point to send some questions in the chat or unmute and say a question out loud as well. Whatever you guys want, we're here to help you out. But we'll move on to the next concept. So something else that's also often tested or discussed in ethical stations is the concept of truth telling. So obviously that's a really important in lots of things in life, but especially medicine, being able to tell the truth to patients, to your colleagues, to yourself, especially because sometimes the truth isn't nice. So it can be really hard to tell, but it is important. So that's something that's discussed. Confidentiality, another huge one that will be tested. And professional boundaries. Again, this relates to all professions, but is really important in medicine as well. So it will be something that is commonly tested with ethics stations. So how to prepare specifically for ethics stations? As we've sort of already touched on, it's important to learn and research about key ethical topics. But again, don't spend too much time, divulging into these huge theories, because people literally spend their lives work on ethics. There are academics out there who write very complex papers and theories about this stuff. And it's not necessary for us to be on top of it at that level. However, whatever concepts that you can read about, listen to a lot of podcasts about it as well, like our podcast, but other podcasts as well. If you can just start listening and engaging in conversations about ethics and what they mean and what they look like, that will help you get more confident about it. And again, as Karim said, it'll just help you get enough knowledge to be conversational about these topics, which is the key goal. And also start thinking about your preferred ethical framework. This is something that we've spoken about on the podcast extensively, but because it's really important, especially in ethics scenarios where they give you a big convoluted scenario and then a question that's just as broad as what are the ethical considerations. You need to have a game plan for that, about how you're going to effectively answer the question under the timed condition. So different models we have spoken about in the past is the who, what, when, where, and why model. So the 5 W's, as we like to call it. Or if you're going to stick to the 4 main pillars of medical ethics, talk about those and what else is relevant. Or if you're going to have an inside out approach, so looking at the individual, why it's important to the individual, or how this scenario impacts the individual, how it impacts their community or direct surroundings, and how it influences a greater government or the nation or the world. Showing those different levels of impact is also a great approach. But also just practice lots of different station types and continually work on your communication skills. That's probably the key advice for all stations as well, I think.
I'll just mention there as well, for the 4 pillars model, a lot of students just stick with that and then nothing else. So they talk about, they get asked, what are the ethical considerations here? And they go, autonomy, non-maleficence, beneficence, justice. And they focus only on that. And they almost try to like mold the station to fit that structure when not all the 4 pillars might apply. So think about those other ethical concepts that we brought up in the previous slide and how they apply specifically to that particular model.
Yeah, exactly. Think more broadly, and always try to start with what is most important as well. I think that's the key thing. But yeah, good point. Karim, did you want to run through the personal attributes station?
Yep. So personal attributes station can be really, really challenging because you get asked to talk about yourself and most people do not want to talk about themselves. So it's something that you need to become comfortable with. You need to practice a lot. You need to be able to talk about, things that you've achieved before in the past, and really understand who you are, and especially in terms of your professional identity. So the point of the station is to figure out who you are in your professional career. So they want to determine your characteristics. They want to figure out if you're suitable for pursuing a career in medicine. Now, Gabby disagrees with me on the following points, so maybe we can discuss this a bit. But the idea is that they're not necessarily trying to identify who you are as a person, but rather your professional identity. So they don't care they're not likely to ask about what your hobbies are. They don't necessarily want to know what sports you do on the weekend. Maybe they do. Maybe you can bring that up. But most importantly, it's who you are in your professional identities. How has your career progressed so far? And if you're thinking, heck, I don't have a career, I've only done an undergrad, that is a career. That's a step that you took towards getting into medicine or getting into dentistry, whatever it might be. So just figure out who you are, especially in terms of professional identity. And, still be able to have a conversation. I'm not saying they don't want to know that you're kind and empathetic and good teamwork and all that stuff. But they want to know that, especially in the context of your professional identity. Gabby, do you disagree with this?
Yeah, no, I agree. I just would like to think that this is the time for you to show the examiner who you are. And yes, a large part of who we are is our professional identity, just because we are, pursuing a career such as medicine, which is going to be a large part of your life. But asking questions like about your personal experiences, about what are your best traits, how have you learned things? I think that just demonstrates different parts of your personality that you can't necessarily show in other station types. So for me, the best way to think about this is and because I think as well, I felt a bit awkward sharing different experiences, and when they say, what are your strengths, I'm just like, well, I don't know. So I think it did really help me to think, right, the reason why they're asking this is just because they want to know who I am. It's like I'm on a speed date and I have a short amount of time to tell this person who I am and what's important to me. So for me, it really helps me to think about it in that way. But I do agree with you, Karim, but I just like to think that it is a chance for you to tell the examiner exactly who you are and who you are outside of medicine as well.
Yeah, absolutely. And obviously, there's so many different ways that they're going to assess this. But in terms of the main things that tend to come up a lot, a very common station is why med. And even if it doesn't come up, you should definitely know that answer back to front. Not so much memorized word for word, but know the key points that you want to discuss whenever you get asked this question, or what other questions might revolve around that question. So often it'll be things like, why pursue, and we sort of talk about the idea, like they might not say why med, they might say why pursue a career in health sciences, or why do you want to get to know why do you want to what attributes make a good doctor or something. They'll sort of dance around the question. And so you have to sort of be really well versed in your reasons why you want to study medicine. So that's sort of the biggest takeaway from this slide. But other stations that are very, very common, teamwork stations, extremely common. You'd be hard missed to have any university not ask you about teamwork at some point during their MMI process. Dealing with stress, also extremely common because it's such an important part of being a doctor. Facing adversity, especially how you reflect and how you overcome that adversity. Accolades and achievements, and this is where I talk about the idea that your professional identity is so important. What have you achieved in the past? Who are you as a person? What things can you bring to the table? Essentially, it's like a job interview. You want to be able to talk about your achievements. Strengths and weaknesses. This is one that people tend to really struggle with, because once again, no one likes to talk. Well, not many people like to talk about themselves, but have a good idea of what your strengths are, what your weaknesses are, actually what your weaknesses are, not just what are they kind of like, or oh, I work too hard, that sort of thing. Like, figure out what your weaknesses are and how you're working on them, essentially. We've left a question here for the audience. If you guys want to put into the chat, is there anything else you guys think they could ask?
And while you're all writing it in the chat, I will just reiterate what Karim said about knowing your answer to why med. Something that Karim has said to me that I really agree with, and I think is a really great reason as to why you should know this answer, is because the reason why you pursue med is what you're going to fall back on when medicine gets hard. And medicine does get hard, as Karim and I say all the time, when you're struggling to balance placement with part-time work, with watching the lectures and getting assessed all the time on different things. Med is hard, and that's just med school, not the career. So knowing your answer to that question is really important because it's going to mean a lot to you in the coming years.
Yeah, absolutely. Got some really good additions here from the audience. So conflict resolution, yeah, definitely a very common station. Problem solving, especially in the context of a team, how you can problem solve as a team. Leadership and how you display it, absolutely. How have you displayed leadership in the past, that sort of thing. Why not another healthcare profession? Yeah, absolutely.
That's a great one. And I think that is something you should definitely reflect on. Nursing and being a nurse and being a doctor are similar in many ways. So what distinguishes that for you, and why don't you want to do something else? That's really important. Role models and influential people in your life, another submission. Yeah, that's an important one as well. And sort of, I think something that we didn't maybe mention with the weaknesses, Karim mentioned like knowing how you're going to improve in your weaknesses or how you have improved in your weaknesses, that's definitely something to bring up. But also sometimes when people do that, they sort of say, this used to be my weakness, but now I'm fully recovered and I have no weaknesses now. And this not only comes off as a little bit disingenuous because you probably haven't completely gotten rid of all your weaknesses, but also it doesn't show full thought and sort of reflection about things. So you can say, you know, this has been my plan for overcoming this weakness and this is the progress I've made. However, I still need to make this progress and this is the way I'm going to do that in medicine. I think, yeah, it's definitely not a weakness to show your weaknesses that haven't been completely resolved yet.
Yeah, and that question is just so hard. Like I remember when I was preparing for these interviews, you know, really truly reflecting on your weaknesses is difficult because we try not to think about them actively. I think it's hard for us to say we have something wrong with us, but like we all do, it's normal.
Yeah. And you're like, I know my weaknesses.
We have another cheeky one from the audience sent anonymously. What do you deadlift? Yeah, definitely not like it.
maybe have something prepared. But I think, yeah, with the weaknesses, you sort of you may know your weaknesses, but you don't want to tell the examiners, but definitely tell them it's okay to have weaknesses. And how should we prepare for this station, Karim?
Yep. So how to prepare? We've kind of already talked about this, but figure out who you are as a person. Really, what are your attributes? What are you good at? What are you not good at? And ask yourself the common questions and really have a good answer for them that you have prepared. Once again, not word for word. Don't try to memorize things, but what are the key points you want to talk about? Just so you're not left fumbling when you are asked that question. And it feels good when you're prepared because you're like, oh, I know the answer to that. You just spit it out. This one is sort of to help with structure. So think about telling a story. Not only does it help your response become memorable, help you stand out, it's also much easier to communicate. And so the way that you can tell a story, there's a few different ways that are recommended online. The really popular one is the star structure for answering these types of questions. So they'll be like, tell me about a time when you showed leadership. All right, very common question. So you're like, okay, here's the situation. Here is a task that I had to complete. Here are the actions I took, and here is the response and reflection. So it's not just response, but what was also the reflection. And that's a really, really great way of telling a story. It makes it memorable, and it's really, really easy in terms of structure. The other way to sort of, and there's more ways than this, but these are the ones we recommend. Just what was the start, middle, and end, essentially. So like, this is what happened. This is why it's important. And here, like sort of the middle, the part that you really flesh out why you're bringing this up, why you're answering the question this way. And here is my reflection or learning. Yeah. Did you have anything else to add, Gabby?
No, just to, emphasize that structure is really important here, because you can get carried away when telling a story and say, this happened and then this happened and then this happened and then this happened, and the examiner finds it really easy to get lost in that. As we examine mocks, there's definitely, when students do that, I zone out. So it's really important to have a clear structure and emphasize the key parts of the story that you want the examiner to remember. And your enunciation will help with this, but also your structure will really help with that. But any questions about the personal attributes station? I'll wait a couple seconds for things to be sent through the chat. No? Okay. If you do come up with any questions, feel free to write them in the chat, but we'll jump to the next station now. So this is the task or explain station. So this is a little bit of a weird one, but the different ways that you might have seen this assessed is you have to give directions to a teammate, whether that's, actual physical directions or directions to complete the task. You have to follow complex instructions. You might have to explain a scientific term or a complicated graph. It could also be one of the detechnalized stations. So, there's a really hard scientific word and you have to explain it to someone who doesn't have scientific literacy, maybe, someone in high school. These are the type of stations we're talking about. So basically, the reason why these exist is to see how you perform under pressure. And it's not just about testing how you can carry on a task, but also how you reflect on it and how you plan to improve in the future. So often when these stations exist in interviews, there is a minute or two left at the end of the station for you to, and then the examiner will ask you the question, how do you think you went? Or what could you do better next time? And this is your chance to really show them how you can reflect on the things that you do and how you can learn from them, because that's a huge part of being a medical student and being a doctor. We stuff up all the time and you have to learn how to reflect on your actions and learn from them. And even if you don't stuff up, you're going to be doing hard tasks. So you need to be able to critically analyze the way that you perform those tasks so that you can improve, or, just keep being consistent. Anything I missed there, Karim?
No, that's pretty much it. Honestly, yeah, the reflection part is probably the most important part of that station. Just the idea that, like, how can you be better for the future? I think that's really, really important.
Yeah, for sure. And in terms of how to prepare for these stations, like all stations, practice is pretty important. But it can be hard to practice for these stations because, you sort of have to come up with them yourself, and you're trying to think of something hard, and it can be really hard. So have a look on the internet, have a big search of things to find, but also detect stations are really easy to practice, because whoever your practice buddy is, get them to get a random word and make you explain it. It can be as simple as a word like hormone, or on the podcast recently, Karim just explained nucleus. Those things may seem really simple to us, but when you try to break them down, they're really hard. So definitely practice that and try lots of different scenarios as well. And think about why you're being asked to complete the task, so whether it is because you have to explain something, or your communication skills have to be simple enough to be understood by other people, or whether they need to be, structured enough to be clear. Just think about why you're being asked to complete a task, because that, I think, just helps you then implement it and do it in a good way.
I think just on that point, it's so important, because if you're asked to do something with a teammate, for example, they're looking to essentially analyze your teamwork skills, right? So if you know what the point of the task is, or why you're being asked to do it, it helps you figure out how to then structure your response for when you're asked to reflect on it. Or just how to better carry out the task. If you're asked to be a teammate, they don't really care if you complete the task. They care more about if you are kind and empathetic to your teammate.
Yeah, for sure. That's really true. And, if your teammate doesn't do the task perfectly, that may have been what they've been asked to do in the scenario. So don't get frustrated at them and think that, okay, now I'm screwed. Now I'm going to score badly. It's not about that. Exactly as Karim said, it's about your communication, teamwork, empathy skills. That's really what's important. But again, like any station, it's really important to be able to structure your response. So when giving instructions, figure out what your goal is first. In that reading time or thinking time that you have, you really need to think about, okay, what's the end goal and how can I break it up into small, bite-sized, easy, digestible steps? Because usually the task is hard, so you can't just, start from the start and jump to the end. Think about what the small steps to get to that end goal. Take your time as well, and constantly get feedback from your teammates. Say, am I going at a good pace? Do you have any questions? Does that make sense? And are my instructions clear? Asking for feedback from your teammate can really, really help you. And it, again, shows great communication skills and great teamwork skills. But it also means that you are actually making progress along the way. Remain empathetic, as Karim has mentioned, and try not to get frustrated with your teammate. Really important not to do this. And make sure you reflect at the end on yourself and your teamwork skills.
Gabby, we've just got a question. So the question is, are these stations typically done with other interviewing students in front of an interviewer, or are they one-on-one with the interviewer?
Yeah, so it depends. In panel style interviews, some universities will have multiple students in the one room where they may ask you to complete a task. I know of one university that does similar things to that. But most of the time you're going to be one-on-one, and it's going to be in an MMI situation. So it'll just be like any other room in the MMI. So, a room with you and the examiner and maybe one extra person. That extra person may be training to be an examiner. They may be observing for like quality control reasons, or they could be like an actor or something else. So it's usually just you and the examiner, but it could be one other person as well. But great question. Okay, on to Karim's favorite station. Is this your favorite station, Karim?
Absolutely not. I think it's my least favorite station. So the acting station. Obviously a station that sort of throws a lot of people off because, there's just so many different things that can come up. I just thought we've got a question first. Do you have any tips for a question where the examiner asks you to explain something, but you aren't too sure what it actually is? Honesty, probably the most important thing here. Would you agree, Gabby?
Yeah, this actually happened to me. The DTech station in one of my interviews, they gave us like 4 words and we had to explain 2. I knew one of those words, and the other 3 I like vaguely knew but didn't know well enough, and I panicked straight away, understandably, but I wish I hadn't panicked. So what I did is I first just tackled the word that I did know and did that confidently, and then I just chose another word and I said, I was honest and I just said, this is my understanding of this concept. However, if I was explaining this to someone, I want to do a little bit of research first to make sure that it is correct, make sure that I am explaining it in an effective manner, just something like that, and then continued on to the best of my ability. Still give it a shot. Don't just walk out of the room. Don't cry. Don't freak out. But definitely be honest and, state your limitations, but also state how you're going to go about that. Don't just say, I don't know. Say, I would like to research this further or ask a colleague, etc.
Yeah, exactly mirror that response.
Mm-hmm.
I think that's pretty much what you need to focus on. Just be honest.
Yeah.
They don't expect you to know every single word. It's fine.
No, not at
and
all.
I explained, I remember the word that I had to explain in one of these interviews. There were multiple meanings, and I walked out and I was like, oh, maybe they wanted me to explain the other meaning, but like they don't really care what you choose to do. It's more about the communication, right? Like this, and this is what comes back to that point of what is the point of the station? What are they trying to get out of me? And really, it's communication essentially.
Yeah, it's not a content test. You've already had your content test through your GPA and the GAMSAT. This is about other skills, like your communication.
The soft skills. Wait, is it the soft skills? Anyway.
Yeah, it is. Oh, another question. For personal stations, if I absolutely can't think of a personal experience for the question, can I talk about, say, a family member's experience and then reflect on what I learned? Yeah, I think you can. Okay, there's a couple of things that I'm thinking about from this question. First of all, I think it's really important to have a couple of personal examples lined up, where you've displayed different attributes like teamwork, dealing with conflict, things like that. Reflecting on your own life and having a few sort of examples in your toolbox walking in is really important. But again, if none of those examples fit and you feel like it would be weird inserting them in, or if you can't think of anything, and it comes to that, I think as long as you don't insert yourself into that situation and say that was your experience, if it wasn't, because don't lie, they can definitely pick up on when students are lying about the experiences. But if you do, explain it as my family member or friend went through this, and this is what I learned from watching them going through that, I think that would be okay. What do you think, Karim?
Yeah, I was just going to say the exact same response. I think that would be totally fine, as long as you are clear about what happened, you're clear about the situation, what your task was, what actions you took, and your reflections. Structure it. If you can structure it and show what you learned, there's nothing wrong with that. It's still a life experience that you went through, just indirectly through someone else. And then just remember to maintain, I want to say like maintain confidentiality, but like, respect the privacy of your family members / friends. That's pretty obvious.
Yeah, that's true. That's a really good point.
All right. If there's no more questions, we can get into the acting station. So the point of the acting station is to really test communication and empathy. That's sort of the main point. The examiners do understand that these stations are really difficult and that the actor might vary their response student to student. The actors, actually, I don't even know. They may or may not have a script. They have an idea of like how they're meant to sort of behave and what they're meant to say, but they might not be exactly the same from student to student. But the examiners are like aware of that, so they'll take that into consideration when they're giving you your mark. Typically, when you walk into stations, there'll be an actor off to one side, the examiner off to the other side, and the examiner usually just guides you towards the actor, and you almost have no interaction with the examiner. But often these stations are difficult because the actor is in emotional distress, and you're asked to speak to them, comfort them. So that can be really, really challenging. There's a few different types of stations that we've tried to sort of summarize. One of them is I'm lost. I'm, somewhere new. I have dementia. I don't know. It doesn't really matter, but they're sort of lost somewhere and you need to sort of comfort them, maybe help them out. They've just received bad news. Someone thinks they are sick, but they don't think they are. Or just straight up, they just won't agree with you. Like you'll be required to convince them to do something, and they just won't agree. Like, oh, do you, take your vaccine, or I think this vaccine is really important for you. And they're just no. So very, very challenging, but lots of different things to sort of prepare for. And there are so many different types. So these are just some of the common types that can come up. So there was a question.
Yeah. So the question is, any predictions on how acting stations could be conducted via Zoom?
Yeah, we kind of talk about how with the way the world is, the global pandemic, and like with all the interviews being on Zoom, some types of stations are really, really hard to run. So they might choose just not to run them. I think acting station is probably one of those, would you say? Or like you might be asked to react to a situation instead?
Yes, so they can turn the acting stations into scenarios and say, if someone was to come up to you on the bus and say that they're lost, what would you do? Or if someone was to ask you for personal advice because they know you're a medical student, how would you react? Or what I've also seen with online interviews last year is you'll join a Zoom and there'll be an examiner and the actor, and it'll just be having the conversation with the actor as if you were sitting in real life, but it's via Zoom. So if you have any Zoom element to your MMI or your medical interview, that could definitely be a possibility. And I'd be getting prepared for that, because that's a really great way for them to purely test your communication skills, because you can't do anything like offer them a tissue. You can't, touch their hand or anything like that, because it's all on Zoom. So that's definitely a way for them to assess it as well.
And it could get so awkward as well, like if they start crying. So just be ready for that. That's sort of one of our pieces of advice is be ready for them to be upset, be ready for them to cry or be really angry. It could happen. What would you do? So do prepare for that. And yeah, we've even mentioned, if that happens on Zoom as well, like how would you react? Yeah. So just have an idea of what an appropriate reaction would be. It's obviously showing empathy. If someone's really angry, obviously remaining calm yourself is really important.
And with that, Karim, how would you react? If we were in an interview right now, I was the actor, I started crying, what would you do?
Well, I'd probably give you a few seconds first and just let it happen organically and just embrace the silence. And then, you've really put me on the spot here. And then, just offer kind words, good communication. Hey, I'm really sorry you're going through this. Like, I know it's really tough. And just
Yeah.
pause and just let that silence, and you can look up sort of, no need to be robots about it. There's no like, oh, I'm going to wait 10 seconds and then I'm going to say this exact phrasing. But you can look up what are good responses to when patients are distressed, because that's essentially what they're testing, right?
Yeah, I think that's good. Waiting, letting them sort of feel their emotions and not pushing down their emotions straight away and being like, it's okay, it's okay. Let them feel their emotions, let them express their emotions, listen to them. Don't be afraid of that silence as well, because silence can be really powerful for yourself to gain and gather your thoughts to know what to say next, but also for the patient. That might be the first time that they've ever, cried, or the first time they've ever shown emotion about this particular thing. And I'm making it really clinical now by saying patient when it could just be a stranger on the bus. But anyway, and then exactly what Karim said, then saying, apologizing, or showing some comment of empathy. And then, offering some open-ended question, I think would be great next, to let them explore their emotions even further. Be like, can you tell me more about how you're feeling? Or, something like that. Have you spoken to anyone about this before? That's a great question, I think, as well. But yeah, not being afraid to have silence and let the patient or the person be upset and show their emotions.
Yeah, and that pretty much summarizes our structure for this. So be empathetic, stay calm, mostly listen. That's really your job in this station. That's part of great communication is listening. And then recognize your role in the situation. Are you a stranger? Are you a close friend? What's the appropriate reaction for who you are in this situation?
Yeah, exactly. Right. And especially stranger versus medical student as well, because obviously there's a professional element that comes into that. But yeah, I think that's really great. And in terms of listening as well, active listening is a really important concept. If you haven't heard of it before, I think it is key for medical practice. It's the idea of listening to listen and listening to understand, rather than listening to respond. So when the person that you're talking to is speaking, you are just sitting there and listening. You're all focused on them. Your eyes are on them. Your ears are on them. And you're not thinking about what you're going to say next, or what the potential problem is, or what the solution is. You were just listening to understand, and to sort of, put your feet in their shoes a little bit. Did that make sense, Karim?
No, that was good. I like the listen to listen part, especially.
It's our new motto. Okay, before we move on to a little practice station, does anyone have any questions or anything that we need to sort of go over again? I'll just wait a couple more seconds, because I understand that typing takes longer than speaking. Okay, I think that's enough time. So what we're going to do now is we're going to practice. So we're going to run through an ethics station and discuss how you might approach it. So for each question, we'll pause and let everyone sort of think about how they might respond. And then Karim and I have come up with a few things that we'd like to talk about in that scenario. So on the next slide, we're going to put the scenario, and we'll give you 1 minute to just read it and think about it yourselves, and then we'll jump to the question. Okay, so don't write anything in the chat yet of what you think you should talk about. Just spend the next minute reading and thinking to yourself before we discuss. Okay, here's the scenario. I'll set a timer.
So you've got 1 minute to think about this. This would be perfect time for my music.
And with that, Karim, that's 1 minute. So turn it off. Okay, hopefully that was enough time for you to read that scenario and have a think about it. So
ding, 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 come into the room, introduce yourself. Hello, my name is.
Or open the Zoom or start the recording.
Or just record on Zoom.
Press record. So the first question is, what are the ethical considerations? Before we talk about what Karim and I have already sort of thought about, type in the chat what you think are some key ethical considerations in this scenario.
Confidentiality, yep, a very
Ding, ding,
important
ding,
ethical
ding.
consideration.
Integrity,
Integrity, autonomy, yeah, absolutely.
The GP,
the GP wanting to help the patient, beneficence, informed consent, absolutely. You know, anytime someone's jumping on a medication, informed consent. Anything else? Yeah, what is the reason? Yeah, obviously, like getting into the medical side of things, so wanting to provide benefit to the patient. Health
literacy.
Yeah,
that's absolutely. A really great consideration to think about. Yeah, what language you need to use and what language the doctor needs to use, and in order to have an effective conversation with the patient, but also how much the patient knows about what they're requesting as well. That's really, really great one.
Yeah, that's a great point. It's really fantastic.
Here are a few things that we spoke about. Karim, did you want to run through this?
Yep, absolutely. So I thought a really great structure for this one is just a simple 4 pillars plus what's relevant. So obviously the patient trust, safety with their physician, especially their physical and mental health in terms of their safety. So feeling secure with their GP in terms of trust, but also in terms of physical, like actual, this medication, is it good for her? Is it going to do good? Autonomy, so obviously Ella's right to choose, privacy, confidentiality, which you guys brought up. The fact that it's a small rural town, so there's potential for things to spread. And so this is why we talk about the 4 pillars plus what else is relevant. You know, like it is important to consider this is a small rural town. So there is, you know, if this is somewhere out in, you know, Western New South Wales or something, and it's the only town around for a while, you know, is Ella going to have access to other healthcare facilities that she could get the oral contraception prescribed from? So just thinking about that. And I think someone just mentioned it, you know, the potential effect on rural community if the doctor doesn't maintain confidentiality. So yeah, really important.
Yeah, and I think, again, patient safety here, that's been touched on by what that student just wrote in the chat. So the fact that if that patient doesn't trust this doctor, where can they go to? But also, you know, the safety of other patients. You know, if this patient in particular can't trust this doctor because that doctor can't maintain confidentiality, then other patients in the community might not go to that doctor, and it has these knock-on effects. So there's lots of things that you can bring up. So it's really hard to think about what's important. And, you know, Karim and I might have 2 different things of what we think is most important here. For me, I think it's the rural town aspect, the fact that the patient might have nowhere else to go, and she is asking for something, and she wants to feel trust in her GP, but she doesn't. And it's just complicated by this rural town factor. So I think it's important for you to have these considerations, but also know for yourself what you think is most important in this scenario and start with that.
Yeah. And we also mentioned first things first. What is most important to you? Yeah, very important.
Yeah. Okay, second question. What is the significance of this being in a rural setting? We've already spoken about it, but definitely write in the chat what you think.
Yep.
I just got a question.
Very important.
So I just got a question from a student while everyone's writing in their answers for question 2. The student knows that I'm from a rural area, and they have asked, would I bring up my own personal experiences here, i.e. having lived in a rural area myself, and how that affects my opinion? I think I would, because I have had an experience where, like, the GP that I was seeing at the time, I wasn't necessarily satisfied with. However, every other GP in town was completely booked out. So yeah, that is relevant to me. So I would bring it up. I wouldn't focus on it too much because I would want to make sure that I actually answer the question and, break down the nitty gritty of the ethical considerations. However, I think it is relevant. This personal example of mine is relevant in this scenario. So I would bring it up. Yeah.
Yeah, we talk about this idea of like having a memorable response, telling a story. And the reason we bring it up is because, yeah, I think human nature is that, we love to listen to stories and they make sense and we can really easily follow them along. And because you essentially do get marks for the way that you structure your response and for clarity, and essentially the clarity and content of your response, if you can tell a story and if you can bring personal aspect into it, absolutely. But don't force it.
Yeah, for sure. Don't force it, and don't only speak about your personal story and not answer the question that's being asked. So in terms of answers to this question, so what is the significance of this being in a rural setting? People have said access to care, great one. Lack of alternative options. In terms of trust in the doctor, if she doesn't trust this doctor, she might have to travel far to see someone else, which under that becomes a lot of other problems like time, money, other resources that this patient has to then use in order to seek healthcare and healthcare support, which is an added layer of complexity that someone in the city might not experience. More close-knit community, parents may ask GP about Ella. This is a really key one. I think, yeah, confidentiality in many different ways. But Karim, did you want to run through what we thought?
Yeah, so we had very similar ideas to you guys. So resource availability, is there someone else that she can see? News spreads fast. So that was the idea that, could the parents potentially ask the GP? Even just walking into the clinic, Ella might see people that she might know. Do those people have access to her notes? Hopefully not, right? But, if there are nurses, if there are other healthcare staff, part of the team. And so the importance of their respect for privacy and confidentiality. And then in terms of structure, we kind of just talked about, maybe you'd like to set the scene first. So the difference between metro and rural, you might just choose to focus on rural. It's completely up to you how you structure this, and then just acknowledge the important points. So we would start off by saying, it's very important that we acknowledge that this is in a rural setting, as opposed to in a metro setting where Ella might have access to many different healthcare providers. Whereas in a rural setting, she might only have access to one, and therefore, and so on and so forth. I think we saw a question. Cultural barriers, cultural considerations, absolutely.
So the question was, is Ella Aboriginal or Torres Strait Islander? Cultural considerations, would that be too far from the question?
I mean, never equate rural for Aboriginal or Torres Strait Islander. I think that's a really important point to bring up there. But if you pose it as a question, I mean, there's nothing really, I can't see anything being too wrong with that. No, absolutely. If you think it's an important issue.
I think cultural considerations are always important in any sort of medical setting, in any medical encounter. When someone seeks healthcare support, it needs to be culturally safe. So if there is a cultural consideration here, that definitely needs to be addressed. Because it hasn't been brought up in the scenario, it might not be 100% relevant, but I don't think you would get marked down per se for bringing it up. But I would mention why you're bringing up. Exactly what Karim said. Don't just equate Aboriginal and Torres Strait Islander for a rural setting, because we all know the statistics, hopefully, that the majority of the Aboriginal and Torres Strait Islander population actually lives in metropolitan towns. However, there are rural communities, and there are Aboriginal and Torres Strait Islander people living in rural communities. So it is important, and it is an important consideration, but just make sure you know why you're bringing it up and why it's important.
We have another really great question. Do you have to only acknowledge these questions as the GP or doctor, or could you look into the ethical side of things if she did get the script? Would she feel comfortable filling the script at her local pharmacy? Absolutely. You're not told who you are in this situation, so you don't necessarily have to act as only the GP or the doctor. Absolutely, you can just talk about, the broader societal implications of her needing to get a script somewhere else, bumping into other healthcare workers. Yeah, for sure.
Yeah. But again, I'm just going to be the devil's advocate here and showing the other side of Karim's answer. I agree, like definitely good to divulge into that. However, make sure you're not sort of stepping out too much, because what we see with some students that come through our mock exams is they sort of go, well, if this scenario went ahead, this could happen and this could happen and it could lead to this and this and this. And as you can see, they're definitely thinking about lots of different things, and it's great to see them critically analyzing that and really thinking about how it could affect the different things. But it could also take away from the strength of your response, because, you know, the key parts that you're talking about are sort of being diluted by everything else that all these other examples that you are bringing in. So definitely relevant in this case, I would say, to bring up how she might feel about filling in that script at her local pharmacy, how you know, people she knows might work at the pharmacy. Again, being in a rural town, there might not be as many pharmacies as there are in cities or metropolitan areas. But in other scenarios, it might not be as relevant to branch out this much. Let's move on to the next question. So question 3, what actions can the GP take to make Ella feel comfortable? Again, start writing your answers in the chat. So the first cab off the rank, acknowledging Ella's concerns. Yeah, absolutely. 3 things that one of my tutors has said to me. This isn't really relevant for med interviews, but I'm going to bring it up anyway because it's definitely something to consider. When you're having a patient interaction, always think about the ICE, ICE, ideas of the patient, their concerns, and their expectations of your consult or your care. So definitely those 3 things are what I would want to be bringing up. Play lo-fi music, says Mark. Absolutely. That's going to be in Karim's consulting room, I'm sure.
I'm not going to say anything. I'm just going to turn it on.
Reassurance, discuss with her options. Absolutely. That's a part of her making her own informed decision making, and her ability to have autonomy over her own care. Assure her that they won't break patient confidentiality. Great. Explain to her about doctor-patient confidentiality. Assure her that she is entitled to patient confidentiality and that she's not allowed to share anything with the community. Yeah. And lots of other great responses there. Looks great. But we'll run through what we think. So Karim, what are the key things here?
Yep, very similar to what you guys have already talked about. So definitely acknowledge her concerns, actively listen, reiterate her privacy, make sure she completely understands the interaction that is occurring. Provide plenty of information, both about the things that she's asking about, so the oral contraception, but also about, you know, how privacy works in terms of the patient-doctor privacy. You know, she might not fully have know about this. You know, maybe that's why she's concerned. Maybe she doesn't really understand it that well. And you'd start off by saying, what do you know about patient-doctor confidentiality? Just to gauge her understanding first. Her right to have safe healthcare, that's something that should definitely be brought up. Allowing time for her to ask questions, giving her options for other resources that she can seek help from, whether that be online, whether that be a brochure, whether that be someone that she could go see in the city if that's what needs to be done. So someone else she could go see in another town. I mean, if that's her wishes, by all means. The structure for this definitely varies. It's sort of asking about actions. I think the way that I like to answer this is, if I were the GP, my number one priority for me would be so on and so forth, and why, right? You don't just say what you would do. Why is it important? So it's the what and the why that's really, really important in this question. Because I will say most people will have the same what, they might not necessarily have the same why. And having clear structure for your why is more important. I'd rather only mention 3 things, you know, but explain them well, than mention like 50 things and just throw them off, you know. Yeah.
Yeah, exactly. Okay, the final question attached to this STEM is, why is confidentiality important in medicine? This is a juicy question, but start writing your ideas for this question in the chat.
And these are the more sort of cerebral questions that really get you thinking. And it's where we talk about the idea of like being conversational in these ethics topics. This is why, so that when you get these sort of questions where you need to actually like really, really think, you can answer them well.
So the first response to this is so that patients can have trust in healthcare services. Yeah, something we spoke about at the start, very important. Can impair trust in the doctor, which may lead to patients not divulging essential information for treatment. And that's where safety comes in as well, I think. If the patient doesn't trust the doctor, they're either not going to seek medical care or they're not going to tell the whole story to the doctor, which could be really detrimental to their safety, because we need the whole truth to be able to come up with an effective and sound management plan. So if the whole truth isn't there, then yeah, maybe the management plan isn't appropriate. So that's really great. It allows the patient to feel safe and express all their concerns without needing to worry about how others may react. Yep. Ensures trust. If she's had a bad experience here, she might not seek out medical help again. I really like this one. Patients are going through some of their most vulnerable moments. It is not appropriate to be sharing patients' personal experiences to other people. Yeah, that's really key. And patients come to health professionals in really vulnerable states sometimes. And, you know, the power imbalance is always there and you have to be aware of that. And it's just really important to remember that if patients are coming to you for help, your number one job is to help them. And yeah. When patients trust that information will be private, they're more likely to share. Again, yes. A person feels more empowered and feel okay with sharing information. In the past, medicine took a very paternalistic approach and it took power away from patients. Great. In order to provide the best care, doctors need to be informed, and that often requires having personal information about the patient. Without this, the patient is not going to receive the highest quality of care. Yeah, great. You're great. So, Karim, talk us through what we were thinking in this scenario.
Yeah, all really excellent responses, but this is why we talk about structure, because it adds complexity to your answer. And so we really like these types of questions because when you have a good structure, you can come up with really, really great answers. So for this particular question, we chose the inside out model. So looking at the individual, accessing appropriate healthcare, safe healthcare, being able to share everything that they want to say to their doctors, and essentially allowing effective healthcare to occur. In terms of the community, allowing the community to have really good trust in the healthcare system, knowing that that information won't be divulged. This is especially important in rural, marginalized communities where we have not done the best. We've not provided great healthcare in the past, such as, for example, to Indigenous populations, First Nations people. And finally, in terms of a government perspective, looking at medical, legal privacy and confidentiality, costs of healthcare, you know, litigations, for example, social determinants of health, being able to find out patients' social determinants of health and how we can sort of improve those social determinants essentially. So that's looking more at a government perspective. So you can see how having a really good structure takes your answer that's really great and then elevates it and allows you to add more complexity.
Absolutely.
Now, we're not saying that that's the best possible response. You can have a really incredible response just by focusing on the individual. But yeah, we think like having really good structure allows you to sort of address many different points.
Yeah, and I think that really ties off this station quite nicely. And I have a question. So if we happen to have already answered the more general question in previous responses, how do we go about answering it without too much repetition? Is repetition a bad thing? What do you think about this, Karim?
Repetition is not a bad thing. Like if you say something and it was important in a previous question and it's important again, there's nothing wrong with that. Make sure that you are answering the question that they are asking And if you are, then there's absolutely nothing wrong with like repeating yourself.
Mm.
I think it's just focusing on answering the question in a really good structured manner and communicating well is what you should focus on.
Yeah. And maybe just mention, as I said before, or as I mentioned before, and then sort of elaborate on it a bit more and bringing in other aspects if you can, because then if you are, repeating something, you're doing it in a more powerful way. And another question here, putting myself in the interviewer's shoes, what if they gave you a follow-up question such as, you run into her parents at the local supermarket and they mentioned they heard their daughter booked a consult with you. They ask you how this went and what it was regarding. What do you respond to the parents? What key points can you hit here? Oofed, oofed, oofed. Very good question. Do you write the stations? Do you want to join our team? But yeah, that's a really tricky question. What are some key points that we'd want to touch on there, Karim?
Yeah. So you would want, okay, let's think about how you would structure this. So as the GP, I would start to think about what are the parents' concerns, because obviously they're just concerned about their daughter. So you have to be really empathetic. So that's one thing I'd bring up before I respond to what I would say to the parents. But I would just mention that everything that I would say would be really empathetic, because I know that the parents are asking from a place of concern. And then everything you say just needs to be respectful and honest. I mean, if they ask you how it went, you can say, yeah, it was really great. Everything that I discussed with Ella went well. Unfortunately, I can't share that with you, obviously, because Ella's an adult, and it's really important from a professional point of view that I protect her patient privacy. And you can say that to the examiner, and I think that's a really honest answer, and it's an answer that sort of makes sense. But yeah, those would be sort of the main points that I would want to hit. So the importance of patient confidentiality, why the parents are asking in the first place, and the importance of empathy. And then maybe even talking about the importance of preserving your relationship with the parents as a friend. So talking about, there's this professional boundary, but also like, I am your friend and I understand where you're coming from. Maybe talk to Ella about it. Maybe you could just.
I think, identifying your different roles in this situation. So number one, your role is the GP and you are your patient's carer in that scenario. So you have to make sure that that role is kept intact. The other role of you are a member of this community and you are friends with these parents and you don't want to ruin your relationship with these parents. So you want to keep that role intact. But also the other role is you're off duty and you want to enjoy your life. And these parents are asking you about work on a weekend. So that's another thing to consider, is that you're out of the office. So just reiterating the structure that Karim said, because I 100% agree with it. Number one, starting with the reason why the parents are concerned and your role in this situation. And I would probably break down my 3 different roles. And then saying the number one thing that I need to do is make sure that the parents understand that confidentiality is really important and that I can't tell them what went on in that scenario. However, I would then encourage them, if they are concerned, to talk to Ella, and you can book a consult together if you wish, something like that. Keeping it pretty plain and simple, not giving too much indication of what went on, but also not sparking any concern for the parents. Yeah. So hopefully you enjoyed that activity. There was lots of engagement. So thank you all for interacting with that. It was really fun to go through that. Hopefully you found it fun as well. But now, hopefully you enjoy this meme because it's really funny. And Krim and I were laughing a lot on the weekend when we found this. But now let's break down what MMIs look like at each uni. So we have tables here. Feel free to take screenshots because we won't spend too much time on it. But basically, when universities have MMIs, most of the time, each station will have 1 to 2 minutes reading time and then a certain amount of time answering. So here's a breakdown of what it looks like at different unis, the time you get per station, and then the number of stations. Again, as we mentioned in the beginning, this is data that we found in the past week, and information that we found on the university's websites and from various different resources. So it may have changed and it may change again with the way the world is at the moment. So make sure you stay up to date with those changes. But here's just a bit of an idea of what it's been like in the past and what to expect. ANU has a little asterisk next to it because they actually do a different system where it is like half. They have a MMI where they have 6 minutes per station for 6 stations, but then they also have a panel interview as well. So they dabble in both sorts of interviews. Here's another few interviews. The University of Melbourne. Krim and I are very familiar with this. We actually didn't say at the beginning where we interviewed. So I interviewed at UniMelb, Monash and USyd. Krim, where did you interview?
So I interviewed at University of Melbourne and Monash as well.
So they're our specialties, so to speak. But yeah, here are some more breakdowns. UWA is definitely the longest station time, I would say. You get a bit of extra time planning at UWA. So that's something to definitely keep in mind. But panel interviews, again, something that we've touched on. It's utilised by a few different universities, including ANU, Wollongong, Flinders, James Cook, and the University of New South Wales. They usually go for about an hour, and questions can really be anything. Usually they are university specific. So they'll say things like, why do you want to study at this university? What makes you a good candidate for this university and this course at this university? And I think the best way to sort of prepare for that is to look on that university's website, and often they'll say things like, this is what we want from our candidates, or these are our key values at this university, and be on top of that and sort of make sure that they, number one, align with your values and ideas, but also that you're able to discuss those points. But then they'll also talk about a number of other things in panel interviews that you'll also talk about in MMIs. So things like your achievements, your personal attributes, your learning style, your motivation to study medicine, and other public health type things. So the discussion of the healthcare system, analytical thinking, and ethical reasoning. Okay. So panel interviews are basically just MMIs all together, essentially. And something about panel interviews, though, is the key thing is you're not going to be going in and out of rooms like you are in MMIs, even if it is on Zoom. MMIs are really great in the fact that if you stuff up a station, the next station is a completely different thing. You know, we used to go into a different room, have a different examiner, and it was like you were starting fresh. And that was really great for people who I think got nervous because you basically got to start fresh every sort of 5 minutes or so. However, with panel interviews, you don't get that sort of luxury. So the best thing to do, I think, is if you do mess up or if you freak out or forget what you were saying or whatever it is, take a breath and reset, and then continue. And don't be afraid to say, sorry, just one moment while I gather my thoughts or something like that. That's totally fine. Also be prepared for a really long interview and practice longer interviews. That comes with stamina. You know, talking for a long time can be really tiring. And also being able to maintain, you know, your best self for a long extended period of time can also be hard. So think about that. Think about what sort of questions you might receive and practice your responses. Understand your career development very thoroughly. And this is what you'll most likely be assessed on. So as Karim has already said, you know, your professional identity, how you've come, how far you've come, that sort of stuff is definitely things that they talk about. And be ready to talk about your achievements. Own them, back yourself.
Just a quick question from the audience. 1 interview per admission cycle. Yeah. If you apply through GEMSAS, you interview at one place.
Yes. However,
those universities, you can get interviews at other universities that conduct their interviews separately to GEMSAS. So, for example, Monash conduct their interviews separately to GEMSAS. So you apply directly through Monash. USyd, you apply directly through USyd. So you have an opportunity to sit multiple interviews. But if you apply for GEMSAS and you sit your interview at Melbourne, your score goes towards all the GEMSAS universities, not just Melbourne.
Absolutely. So, if you apply for GEMSAS, you get 1 interview through GEMSAS, but can get multiple interviews if you're applying for universities separate to GEMSAS. However, if you are applying through a special scheme, such as international student, you may have additional interviews, and the process might be different. So look into that. But if this doesn't apply to you, then one interview per GEMSAS application. Exactly right. Okay, any questions about panel interviews before we move on? Okay, we'll keep moving because we are running tight on time. But just a note that interviews are going on during a global pandemic. We've spoken about it a lot, but many universities have had to make last-minute changes to their interview process. So some may shift to online interviews with recorded responses like Sonru, which was a platform that multiple universities used last year. Uni Melbourne, Uni Notre Dame have used that. Or it could be like live on a phone call as well, or a Zoom call. And some may even remove interviews from their selection process, like the University of Sydney have done. So yeah, think about that. So it's important to stay up to date with the universities you have applied for. Check your emails, check the information packages they give you, and check their websites regularly. Again, don't get obsessed with it. Don't let it consume your life, but it is important to stay up to date with these. So when does all this happen, Karim? When is it happening?
Yep. So very rough timeline. Sorry, we couldn't be more explicit with dates because it's so different for every university. But specifically GEMSAS universities. The interviews happen in September, October. You'll get your interview offers sometime in early September, usually. And then the offers actually come out early November all the way through to January 2022. So quite a long time through which these results are coming out. But yeah, make sure that you look into this yourself. But this is according to the GEMSAS website that we got this information from. They don't tell you the date, unfortunately. Tips for on the day. I think this is really important. So just some general things. Make sure you arrive early, where your venue is, what time, make sure you allow potential delays in arrival. Gabby talks about practicing getting there. So especially if it's like in Sydney or something, or not Sydney because they're not running it, but if say you live outside of Melbourne, but you get an interview offer at Melbourne, make sure you know how you're going to arrive to the interviews using public transport or whatever. Be confident in your preparation, trust yourself. Each station is its own separate interview. That's probably the biggest piece of advice we can give. We've already sort of mentioned this. If you mess up in one station, it doesn't matter. Just move on to the next one. I actually made the mistake when I was doing one of my interviews. My very first station was really, really hard, and I completely stuffed it. It was some medico legal thing, and I just really, really struggled. So I really, really struggled with that station, and I didn't recover for my next stations. I kind of was a bit upset. But try to stay positive and remember that each interview is its own station. Each station is its own interview. Focus on communication. A perfect answer is not as important as just being able to communicate well with your interviewer. Getting your point across is the most important thing, and practice interviewing via Zoom or online, and practice not interviewing to a person. If you get the Sonru interview, make sure that you practice like just saying a response to a question to a screen and then play it back and see if you get flustered, that sort of thing. If you do get flustered, take a moment to pause, and you can even just say, hey, I just need a moment to think, and allow yourself 10 seconds just to reset. It's better to spend 10 seconds just thinking than like just blubbering on and on. Focus on the positives during the day. If you feel happy, if you feel confident, you will have good, clear answers. And the opposite of that is if you fall into a cycle of you make one mistake, you get flustered, you make more mistakes. It's a really, really bad cycle to fall into. So try to keep a positive mindset on the day. Yeah.
Exactly. And I think that comes down to just focusing on the things you can control. There's a lot that you can't control in medical interviews, you know, the questions they give you, if it's online, different technical problems that could occur, but focus on the stuff that you can control. So if it's online and it's on a platform, make sure you write down all of the key information, you know, the web address, the passwords that you need, the logon details, the times, etc. Get your clothes out the night before, iron them, have a banging outfit ready to go so you're full of confidence. All of those things that you can control, really put your energy into that, because it can really help, you know, calm your nerves, just like any other regular exam. But now let's run through, will you get an interview offer? Karim has done some data searching for you all. So Karim, run us through this.
All right, big disclaimer before I start. I can't explain how hard it was to find this data, like in random places on the uni websites, like random like PDFs, brochures they have. It's really weird where they put a lot of this data. It's not very easy to find at all. But do your own research if you're really interested. Make sure you double check and feel free to screenshot, like Gabby said. So this is just some data for interview offers for each of the different universities. So I'll run through each row really quickly. For ANU, the GPA minimum to get in was 5.6. The weighting of it to get, like the overall weighting was 25%. For GAMSAT, it was 55, 25%. For interview weight, it was 50%. The number of places they have, 64 CSP, 26 BMP, 20 international. For Bond Uni, 6 for a GPA made up 50%. No GAMSAT, interview weight was 50%, 24 graduate and 96 undergraduate places. For Deakin Uni, 6.74 was the average, not the minimum, 50% for the interview. So that means 50% just to get an interview. GAMSAT 66.9 was the average, 50% to get the interview. So your GPA and your GAMSAT, 50% each to get the interview. Don't know what the interview weighting is. They haven't made that public as far as I know. Available places, 89 CSP, 37 BMP. Griffith, 5 for the GPA, that's the minimum, 50%, 50%, once again, just for the interview. The GAMSAT was 50, once again, just the minimum. The available places, 140 CSP, 56 BMP, 35 international. Monash is special because they only take their own students, which is really weird. Anyway, you don't need GAMSAT. Interview weight, honestly, maybe 100%. We don't really know. Like, that's why the asterisk is there, because I don't say. But essentially the idea is you have a WAM cutoff, but we're not sure if they take into consideration your WAM plus your interview, or if it's just interview and the WAM is a hurdle. So we're not sure. Available places, 73 places available for biomed students. 73 places, which are sort of total, 70% of which is biomed students, 53 CSP, 20 BMP. Is there a bit of a question? 40% of your undergraduate degree and then 60% for interview. Yep. I don't know. I'll believe you. We're not sure. Sorry, it's not available on their website anywhere.
But I will just clarify here as well. Something that I was confused about is the GPA here is out of 7. At Monash, we were given our GPAs out of 4 sometimes. So make sure you use the converter. There's lots of online converters that you can use to make sure that you're comparing it to the GPA out of 7.
And the GPA calculations are like super complicated. But they do have a calculator, I think, on the GEMSAT's website. I believe they have a calculator, so you can figure it out. Okay, a few more. University of Melbourne, the GPA weight is 25%. I haven't got a minimum here, sorry. The GAMSAT weight was 25%, interview weight is 50%. These are the number of spots they have, 88 CSP. No, that's not right. I think it's like 300 overall spots available. Sorry, I think it's 100. Is it Sorry, it's
It's
like 30%
So it's
BMP.
recently changed, the University of Melbourne. That's probably why these numbers are a bit off, is because there's a new program specifically for rural students.
Hmm.
So about 35 places are taken for that now. And half of those places actually come from students who have a guaranteed pathway from La Trobe University. So the numbers are a bit up and down at University of Melbourne at the moment. But yeah, our year, it's about 375 in total-ish.
Yeah, so much higher numbers than this. Sorry, I'm not sure where I got this from. University of Notre Dame, 6.63 was the average to get in. 65 was the average for the GAMSAT. Don't know what their weighting is. Interview weight, also unsure. But 43 CSP, 17 BMP, 60 full fee placement. University of WA, 6.87 was the average, and it was 33% across all the different things. 72.3 was the average for the GAMSAT. Available places, 63 was CSP plus BMP, and 30% of the spots were allocated to rural students and some international. Wollongong, GPA is a hurdle. The GAMSAT, 50 is a minimum, 61 was the average. It's worth 50%, and then the portfolio is worth 50% just to get an interview. Then not sure what the interview is worth, but then you've got a CASPA as well, which you need to sit. So that's kind of like an interview from my understanding.
I sat the CASPA. It's more like a situational judgment test type thing. There's like situations and you have to sort of answer as to how you would react.
And then in terms of the number of available places, we really couldn't find it. So if any of you know and would like to tell us, let us know. We think under 100 spots, and they do tell you the rural students make up 55 to 75% of their cohort.
But the reason why they do, and it bounces around a bit, is because they give rural points to students. They don't necessarily allocate spots to rural students. So it can be anywhere between 55 to 75%. Typically, that's what they see. Okay, feel free to send in any questions, but that was just an idea of sort of your stats of how you may get an interview, you may not get an interview, to give you more of an idea. But I honestly wouldn't stress about it too much. These numbers bounce around every year, and they bounce around at different unis all the time. So just don't stress about it. Wait till you get the interview and then go from there. But what you can do at the moment is start, practicing and getting prepared for it anyway. In terms of special entry schemes, this is something that we wanted to mention. If you can apply for any of these schemes, definitely look into them. And they do differ between universities again, so make sure you look into them. Full fee systems, they often relate to your undergraduate degree or even your high school, so look into that. Guaranteed pathways, again, usually something that you have to apply for pre-undergrad. So people may not be able to look into them now, but still something to look into if you'd like. Rural pathways, most places do give rural bonus points, but they also may have a separate application process, like Flinders Uni has a separate application process, and now Uni Melb has a separate process for rural students as well. So it's definitely something to look into. And often you need information about this as well. So statutory declaration form or proof of residency in rural areas as well. And there's often separate application process for Indigenous students as well. So something to look into.
We just have a quick question.
Yep.
How much prep did you guys do a week leading up to interviews? So I'm assuming you mean number of hours. I think it really varies, and it's honestly however many that you think you are capable of doing without pushing yourself too hard and without sort of losing sort of focus on other important things in your life, like university and just your health, like physical and mental health. But I think I would have done maybe 7 to 10 hours a week.
Yeah, Karim and I prepped together. Karim definitely started earlier on in the year than I did, that's for sure. And then I saw him preparing and realized maybe I should prepare. But I feel like Karim, we'd maybe do just together. We would do maybe like 1 or 2 sessions a week, and each session would go for like 2-ish hours.
Yeah.
And we'd test each other. run through stations together, talk about scenarios out loud, that sort of stuff. But yeah, it really depends. Don't, burn yourself out doing it. A little bit each week will go a really long way, I think.
I also had friends who did like 4 hours of practice for 2 weeks and got spots. So like, honestly, it just depends on the person. If you already have a really good understanding of like medical ethics and stuff like that, maybe you don't need to do that much.
And it is, at the end of the day, it is just a conversation about something. So it might not need as much preparation as you think, but I think the key thing to preparation is to do mock scenarios under timed conditions. If you're doing online interviews, make sure that your practice is mimicking that situation. Again, talking to a blank screen if you're going to be doing it like that, doing Zoom study sessions with friends and family if you're going to have Zoom. So make sure it's replicated. Get in your interview clothes as well, so you get comfortable and confident in those clothes. But a really good way to practice is to just practice with family, friends, and peers. At the dinner table, sit down and be like, right, here's an ethical scenario, everyone. Let's talk about it. They don't have to be medical. I come from a very non-medical family, and I had great conversations about ethical scenarios to family. So don't, only practice with medical people. It's actually good to get different perspectives. Also, stay up to date with different news and current affairs, as often stations are based around something current or something that's going on. Also, it will just help, have examples and things to bring up. And do some research and reflection on different topics, as well as a lot of different public health topics. It's good to do your research and know your opinions on different things as well. But also another great way to practice is to tune into our podcast because we break down a lot of stations together, Karim and I. We get advice from current medical students about how they prepared, what they did, that sort of stuff. And we also have mock MMI stations where we actually have students come on, do a mock station with our examiners, and we record it and give them feedback. So that's a really key resource, if we don't say so ourselves. So Karim will pop a link in the chat now to access our Buzzsprout. But basically, our podcast is called The Making of an Incredible MD by Halad to Health. It's available on Apple Podcasts, Spotify, and YouTube. All of our links are always posted on our Facebook page as well. So definitely check those out. But as you can see, we have episodes about specific station types, and episodes of actual stations being sort of run through as well. Are there any final questions before we move on to the final part of this presentation? We'll just give everyone a couple moments. We know we've gone a little bit over time, but hopefully you've found it useful. We do have a question here. What did you guys find the best method to keep up with current affairs? Karim, do you have any cool resources that you used?
Yeah, I've got the SBS News app. There's 2 tabs. You can click on the videos tab and it's got 1-minute videos of like current affairs that are happening.
That's good.
I think that's really cool.
I am very much an audio person. I love podcasts. So I listen to a lot of different like opinion podcasts about public health, and First Nations health as well. But one podcast that I really did find useful for staying up to date with current affairs, it's called The Squiz. And they just give like a quick 10 to 15 minute rundown on the daily news for that day. And I think that's really great because you sort of get the rundown of all these key things and it just tells you the most important things about that news story. And then you can go off and research it more if you like. And then they have these shortcut episodes where they divulge a little bit more into different current affairs. So yeah, I found that useful.
Gabby did just remind me of a really good resource that I used when I was preparing. It's called Ethics Talks. It's a podcast on Spotify. Some really, really interesting discussions there, and all of it's related to healthcare. Super, super useful.
Yeah, that is definitely a good one. Oh, which public health podcasts? Hang on, let me get my podcast app up. Ask the Specialist. That one's about First Nations health, specifically in the Northern Territory. That's a really good one. What else do we have? Just the Gist. That's a good one. Not really public health, but again, similar to the Squiz, giving a rundown on big topics. That one's called Just the Gist. Where is that other one? Indigenous Health Med Talk. The Rural Health Voice podcast. That's a great one. Generally Speaking. When do I stop? Do I just keep going? I'll give one more. The Health Report. That one's by the SBS, and that's really great as well. But maybe we'll do a podcast episode or a post on our Facebook about some really great podcasts that we like. Which app am I using? Apple Podcasts. But I'm pretty sure most of the podcasts that I listed are available on Spotify as well. Okay, we might move on, but if there are any other questions, feel free to email both Karim and I. We're always happy to answer questions. Karim will send our emails through the chat. But what we want to know is we want to hear from you. We want to know, what did you learn today? So we'll give you a minute or so and write in the chat, what did you learn today that you didn't know before? Or write in the chat, what's one thing that you're going to do this week to commit to your MMI prep? We want to hear it. Let's goal set, people. Now play your lo-fi, Karim. I give you permission. Listen to the podcast and practice my why med answer. Great lo-fi.
I hope you guys learned the importance of studying lo-fi beats. That's my main takeaway.
Try to be more reflective. Yeah, that's great.
Someone said using different answer structures. I think that's something we really want you guys to take away from today. Lots of different answer structures. It will just make your life so much easier.
Yeah.
Get better at clear communication by practicing someone else. Yeah, a really good goal to have. Practice. That's awesome.
Find a Zoom buddy and practice. Okay, keep sending through. Sorry, Karim.
Maybe we can move on.
Yeah. Keep sending through all your reflections and your goals. But where to from here? Just a disclaimer, Karim and I don't understand this meme. Eliza put it in and we don't understand it. So if you find it funny, that's good, but we don't really understand. So there's 3 things we want you to get from this masterclass today. Apart from everything else, there's 3 sort of next steps. So number 1 is to register for our next MMI Master Skills Workshop. Again, this is a free event. And this one was more focused around the logistics and a few skills. The next one is really practical skills based rather than content learning. So if you haven't already registered for it, Karim will put a link in the chat for our Humanities, but also check out our Facebook and all the advertising will be done there. The next thing we'd like you to do is stay up to date with our Facebook page. Again, Karim will send a link, but all of our free resources get posted here. So it's the easiest way to stay up to date and not miss anything. We're pumping out a lot of resources on the podcast. We upload a new episode every Wednesday. However, at the moment, we're uploading every Wednesday and Friday. So there's a lot of content coming out. So by following us on Facebook, it just sort of helps remind you of those resources and make sure you don't miss anything. And the final, most important thing we'd like you to do is to check out our mock MMI rounds. They're happening every weekend of September. And this is the sort of breakdown here. So you basically get a 2-hour live MMI with real examiners. You then also get immediate feedback and you get to attend a cohort review, which basically just runs through the station, each station that you experienced, how the cohort answered it, and it gives you your score on the curve compared to everyone else. So that's a really great resource to attend because sort of gives you an idea of how hard the station is and where you sat with everyone else. Krim sent a link in the chat for that one. But again, if you have any questions about our MMI rounds or want to know more information, either reach out via Facebook or email us. But that's it. If there aren't any further questions, thank you all for attending tonight. I don't know about you, but I had a really fun time talking to you all, and it was really great to get such an active and engaged group. So thanks for interacting, for asking lots of questions, and we hope you found it useful.
Yeah, thanks everyone. That was really fun. I hope you guys learned something. I hope you can walk away with something useful. And best of luck on all your journeys. Honestly, I'm sure you guys will be amazing.
Yes, yeah, true. Good luck, everyone. Interviews aren't as hard as you think. They're okay. You're going to be all right.